Hi, and welcome to another telehealth information video. My name is Garvin, and this video is on Oralair. So when do you start taking Oralair? So it is important to know that Oralair is a grass allergy treatment you start taking about 4 months before the grass allergy season begins. It is not a medicine that gives immediate relief of allergy symptoms. This means you may begin taking Oralair when you aren't likely having any symptoms of your grass allergy. You continue taking it every day throughout the grass allergy season until your doctor tells you to stop. Oralair can cause severe allergic reactions that may be life-threatening. Symptoms of allergic reactions to Oralair include trouble breathing, throat tightness or swelling, trouble swallowing or speaking, dizziness or fainting, rapid or weak heartbeat, severe stomach cramps or pain, vomiting or diarrhea, and severe flushing or itching of the skin. If any of these symptoms occur, stop taking Oralair and immediately seek medical advice. So for home administration of Oralair, your doctor should prescribe the auto-injectable epinephrine for you to keep at home for treating a severe reaction. So these are EpiPens or Jext auto pens, and should one occur, your doctor will train and instruct you on the proper use of an auto-injectable adrenaline. So how does Oralair work? The treatment with Oralair is intended to increase the immunological tolerance towards grass pollens, thereby building immunity to the specific allergens in grass pollens, thus helping to reduce the allergic symptoms. Ask your doctor if you have any questions why Oralair has been prescribed for you. Oralair is not addictive. Before you are given Oralair, do not take Oralair if you are hypersensitive or allergic to any of the other ingredients of Oralair, if you suffer from severe or unstable asthma, if your immune system is very weakened, or if you suffer from a disease that attacks your own immune system, if you suffer from malignant disease, for example cancer, or if you have any inflammation in your mouth, so mouth ulcers. Before you start your treatment with Oralair, take special care with Oralair if you have to undergo surgery in the mouth, or if you're having a tooth pulled. You should stop treatment with Oralair for 7 days to allow your oral cavity to heal. Thereafter, restart treatment with the previous dosage. If you stop treatment for more than 7 days, then speak to your doctor on how you should restart treatment. Talk to your doctor if you have had any history of allergic inflammation of the esophagus. During treatment with Oralair, if you have severe or persistent upper abdominal pain, swallowing difficulties or chest pain, please contact your doctor who may reconsider your treatment. Or if you're taking a beta blocker, so it's a class of drug often prescribed for heart conditions and high blood pressure, but also present in some eye drops and ointments, as this drug may decrease the effectiveness of adrenaline, a medicine used to treat serious allergic reactions. So tell your doctor if you're taking or have recently taken any other medicines, including those bought without a prescription. So for pregnancy and breastfeeding, ask your doctor for advice before taking any medicine. At present, there is no experience for the use of Oralair during pregnancy. Therefore, you should not start immunotherapy if you're pregnant. If you become pregnant, speak to your doctor about whether it is appropriate for you to continue treatment. There is no experience for the use of Oralair during breastfeeding either. No effects on infants who are breastfed during treatment are anticipated. However, you should not start immunotherapy if you are breastfeeding. If you wish to breastfeed while on treatment, speak to your doctor about whether it is appropriate for you to continue treatment. For driving and operating machinery, there is no effect on the capacity to drive or use machines has been observed with Oralair. So how is Oralair given? Treatment should be started 4 months before the onset of the pollen season. Always take Oralair exactly as your doctor has told you. Check with your doctor if you're not sure. You're advised to take the first tablet under medical supervision and be monitored for 30 minutes. This gives you the opportunity to discuss possible side effects with your doctor. So the dosage for adults and adolescents and children above the age of 5. The therapy is composed of an initiation treatment, so the first month of treatment, including a 3-day dose escalation, and a continuation treatment. So the initiation treatment, the pack corresponding to the initiation treatment, so the first month contains 2 blisters, one small blister with 3 tablets of 100 IR and one large blister with 28 tablets of 300 IR. So the method of administration, you take one 100 IR tablet on day 1. Keep the tablet under your tongue until it is completely dissolved for at least 2 minutes before you swallow. On the second day, 2 100 IR tablets are to be put under the tongue simultaneously and then swallowed after about 2 minutes. It is recommended that the tablets be taken during the day, and for the continuation treatment, the package corresponding to the continuation treatment, so from the second treatment month, contains larger blister packs with 30, 90 or 100 tablets of the 300 IR. From the second month onwards, treatment must be continued until the end of the pollen season, with 1 tablet of 300 IR taken once a day. So Oralair continuation treatment, which contains the 300 IR tablets only. Duration of treatment, take these tablets as prescribed by your doctor. Start treatment about 4 months before the beginning of the pollen season and continue until the end of the pollen season. Treatment is to be repeated over 3 consecutive grass pollen seasons. If necessary, your doctor may at the same time prescribe medicine to treat the possible allergic symptoms. There is no experience with Oralair in young children, so younger than 5, and in patients over 65. So how long should Oralair be taken for? Oralair started 4 months before the pollen season and continued until the end of the season. Each year your doctor will assess if it is suitable for you to restart Oralair treatment. Results from a recent long-term study have shown that patients treated over 3 consecutive seasons did not require further treatment into the 4th year. If you forget to take Oralair, do not take a double dose to make up for a forgotten dose. If you interrupt the treatment with Oralair for less than 1 week, you can take up treatment where you left off. If you stop taking Oralair, you should stop taking Oralair before the full treatment ends. You may not have an effect from the treatment. If you have any further questions on the use of this product, speak to your doctor or pharmacist. So the side effects. Oralair helps most people with allergies to the selected group of grass pollens, but they may have unwanted side effects in a few people. All medicines can have side effects, so sometimes they're serious and most of the time they're not. You may need medical treatment if you get some side effects. So contact your doctor immediately if symptoms of an allergic reaction occur. During treatment with Oralair, you will be exposed to substances that may cause application site reactions and symptoms which affect the whole body. You may experience application site reactions such as itching of the mouth and throat. These reactions usually occur at the beginning of therapy and are temporary, generally diminishing over time. Stop taking Oralair and contact your doctor immediately if you develop or notice allergic symptoms that affect the whole body, i.e. rapid onset of an illness associated with involvement of the skin and breathing difficulty, abdominal pain, or symptoms related to a drop in blood pressure. Other possible side effects include throat irritation, itchy mouth and headache, and also asthma, stomach pain, diarrhea, vomiting and rhinitis, sneezing and itchy nose and itchy eyes and watering eyes, swelling or itching of the lips, swelling and itching of the tongue, mouth disorders such as dryness and tingling, and throat disorders such as dryness and pain, difficulty in swallowing and hoarseness, and some really uncommon side effects: dry eyes and eye redness and swelling, and ear discomfort and inflammation of gums and tongue ulceration and salivary gland enlargement, throat numbness and allergic reaction with swelling of the face and throat. After using Oralair, You keep it where children cannot reach it. Keep it in the original pack, keep it below 30 degrees, and do not use it past its expiry date. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact me through the website mytelehealth.info or call into us at Lynch's Pharmacy in Douglas and Cork or ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.